He was called the Beriln Patient. He is the one who sets the tone.
All right.
He set the tone for our meeting today. Welcome, Timothy Brown.
I'm not a large Baptist preacher. I hope I can still keep your attention. My mother named me Timothy Ray Brown. The media renamed me the Beriln Patient. I am the man who once had HIV. I don't make this claim as an empty boast. To be honest, I don't think I fully believed it until the New England Journal of Medicine published the case report about me in February of 2009, almost 2 years after I got cured. There's nothing like having a respected medical journal talking about you to drive home the point. Since being cured, I have mostly gone on quietly with my life. Some of you might think I would have shouted it from rooftops. I've always been a pretty private person, so I was immediately satisfied with just being cured. It wasn't until I looked at the bigger picture that I realized that I had to tell my story. By sharing it, I hope that I can bring some new hope and optimism into the fight against HIV. So how does a man from Seattle, Washington, come to the adventure that through the medical milestone half a world away from his birthplace? I was attending school in Berlin in 1995 when I tested positive for HIV. My reaction was that, like that of many others who were diagnosed at the time, I was terrified. I knew many people who were struggling with the disease. Some of my friends had already died from it. I don't think I ever felt as alone as I did at that moment. It didn't help matters that a friend of mine told me that I probably only had a couple of years to live. He actually was the person that suggested I get tested because he had tested positive and he said I should go get tested, and I did. I was tested positive as well. At the time, most of us viewed an HIV diagnosis as a death sentence. Cure was not a topic for discussion. I just wanted to survive. If you are familiar with the history of HIV, you know that the following year brought a new treatment that started to hold the disease in check for many of us. Combination antiretroviral therapy seemed like a miracle in 1996. Really sick people got better, people looked healthier. Over time, we realized that many of us were living longer. I knew that I had a deadly disease, but death didn't hover quite so near. I came to believe that I would remain healthy and live a pretty normal life. The next 11 years were pretty uneventful. Germany's universal healthcare system provided me treatment that most people in the world didn't have. I was also lucky that I mostly tolerated my HIV medications. I got used to the idea of a lifetime pill. The clinics in Berlin allowed me to move HIV to a back burner. My story became commonplace for an HIV patient with access to health care. And unfortunately, that isn't always the case in the United States. And I hope that will change. And I'm fighting for that. Anyway, I'm going to speak to Congress and members of the Obama administration next week. And hopefully they'll listen to me. And I will love to promote a cure for HIV. It wasn't until 2006 when progressive fatigue resulted in a referral to an oncologist. A bone marrow biopsy showed that I had acute myeloid leukemia. have to be a specialist to know that that was bad news. Before I could spend much time wrestling with my mortality, again, I was admitted to the University Hospital under the care of oncologist Dr. Beriln, who started me on standard chemotherapy. Chemotherapy reminded me that treatment for a deadly disease can be miserable. It mocked me. What? Protease inhibitors upset your tummy once? Well, get a load of this. I developed pneumonia early on. I had to start my third round of chemo halfway through when I developed sepsis. I could have died. Fortunately, I had some great doctors. I was released from our hospital. My leukemia appeared to be in remission. But there was concern because I hadn't been able to complete all of the chemotherapy. Dr. Leader recommended me vacation after my treatment. So I took off to Italy. The museums and beaches of Genoa were just what the doctor ordered. In addition to providing excellent advice, Dr. Leader had a revolutionary treatment idea. He was aware of the discussions going on in the HAV research about something called a CCR5 receptor mutation. The CCR5 receptor allows the HAV virus to attach to the T cells and subsequently infect the cell, spreading the disease. People without CCR5 appeared resistant to HAV infections, but they are rare. Only 1% of the Northern European population is this lucky. Unfortunately, I've seen the data dividing up areas of the world, and it looks like only Europe has these CCR5 negative people, and that is very sad because I care about people in Africa and Latin America and Asia, and but I hope that what comes about as a cure that's more readily available. I wouldn't waste what I went through on my worst enemy. Yeah, because it was awful. So I'm hoping that a cure, if it comes about, it'll come about. I hope that it'll be applicable to all of the world.
That's right. That's right.
So why am I telling you this? Well, another treatment for leukemia will wipe out the cancer's immune system and replace it with healthy stem cells from the donor. Doctors decided that a stem cell transplant was necessary. Why not use the compatible donor who has a CCR5 mutation? The idea was that if my cancer's HAV susceptible immune system was replaced by with an HAV-resistant random cell, not only would my leukemia be treated, but HAV might be cleared around my body. I thought, a possibility to cure cancer and HAV at the same time? We could say no to the chances to strike back a disease that may kill some of my closest friends. We could say no to be part of something so groundbreaking. We could say no. Me, that's me. I say no. So let me put this in perspective. When this was first proposed to me by one of Dr. Leader's colleagues, I was recovering from chemotherapy. I had come close to dying. By comparison, my 11 years of HAV treatments had been a cakewalk. And stem cell treatments are very risky procedures. Did I really have to go through extra hell? Some might call me difficult patient. That's not true. I usually follow my doctor's advice. Remember, I can go to early. In January 2007, my leukemia returned. Initial attempts at a different chemotherapy were not successful. A stem cell treatment became a viable option. Dr. Leader screened 67 patients before we had a compatible donor who had the CCR5 mutation. I evidently had 262 donors that matched my HLA type, and because of that, Dr. Leader remarkable idea to look for a CCR5 negative donor, and found one after the 67th try. I want to point out that that wouldn't have happened in the United States because of the way that money is given for treatment of leukemia and other potentially dangerous diseases. Because in the United States, if somebody had the idea that Dr. Weird had, they would have sent it to, they would have asked the insurance company that would have possibly given 2 tests for the CCR5 negative people. It took Dr. Peter 67 tries to find one for me. So that's one thing I want to tell Congress and the environment. The healthcare system in the United States is not working. And I want it to change. I want that to change. Okay. I underwent total body radiation to wipe out my body's immune system before receiving the transplant. I took my last HIV medications on the day of my stem cell transplant. The result, there was no detectable HIV in my system. After 3 months, it was gone. HIV was gone. My T cells increased. I thrived. I went to the gym. With HIV, I had developed wasting syndrome. Without HIV, I developed muscles. I was looking good. I felt good. Until 2008, when I was being returned. Not my HIV. 7 months after my stem cell transplant, off HIV medications, and I was still without protectable disease. Well, the HIV anyway. In February 2008, I underwent a second stem cell transplant from the same donor. My recovery from the second stem cell transplant was complicated. I became delirious. I had to have a brain biopsy done. I come up with some neurological problems that require ongoing care. My life is far from perfect, but it's still my life. It is now 5 years after my first stem cell transplant. I'm still about leukemia, but that's not the reason why you are listening to me today. It is that after 5 years without HIV medications, I still have no trace of HIV in my body. I've been posting biopsies from head to toe. Samples have been taken from my spinal fluid, anal mucosa, and any other place doctors can get to stick a needle. But no virus anywhere. To quote Dr. Uter in the December 2nd, 2010 issue of the Medical Journal Blood, and he's talking about me, it is reasonable to conclude that the cure of HIV infection has been achieved in this patient. Cure. After 30 years of dealing with a disease that has killed more than 34 million women, children, and men, somebody in the medical community said it. Hell, published it. Cure. Not in a it would be great someday if sort of way. He meant today. Now I know my treatment is not about to become a commonplace procedure for HIV, to cure HIV. It is dangerous. It is expensive. But my experience has shown that cure is possible. After all, I am not an abstract concept. I know that we have not yet achieved our next phase of miracles with HIV, a readily available cure. But there are more researchers now who are willing to focus on the cure rather than just treatment. Experience has also shown me the benefit of an effective public health system and the synergy it can achieve working with academic medicine. I applaud those of you in the medical field for your dedication and hard work. I encourage you to continue to think outside the box. Remember that a former infectious disease patient is speaking to you today because an oncologist had an idea about treating HIV. For those of you driven by cynicism or battle fatigue from their long fight against HIV, I hope that my experience brings a renewed optimism. As I finish, I would like to share my dream with you. My dream is not to be the man standing before you and saying, I am cured, but to be the man who stands before you and says, we are cured. Thank you for having me here today.